Good afternoon, everyone. Thank you for joining us. I'm going to give it another minute to allow folks to join, but I really appreciate you joining us this Wednesday afternoon for this press conference. Just allowing some extra time for folks to get in and any type of Zoom hiccups. Although we've been using Zoom for many years, I know a lot of us still encounter some hiccups, so want to give it a little bit of a buffer and make sure that everyone is here before we listen and hear what these mothers have to say today. And with that, I will start. Good afternoon, and thank you for joining us today. My name is Gloria Malone, and I am the Senior Manager of Multimedia Strategies for the Overdose Prevention Program at Vital Strategies. The Overdose Prevention Program works on a number of health-focused interventions to help reduce preventable fatal overdoses. We work primarily in 7 states and have partners across the country, including Broken No More. As we approach Mother's Day this weekend, it is important for us to gather to hear from mothers about their experiences of loving, living, and losing their children to preventable overdoses, and also hearing what they know would have helped their families. Today, we'll be hearing from these mothers who have lost children passed by preventable overdoses. These mothers are turning tragedy into action to help ensure that no other parent experiences the pain of losing their children to a preventable overdose. I want to remind everyone that this press conference is being recorded and will be shared after its conclusion so that anyone would like to watch will be able to watch it. That includes you all if you want to rewind back and hear something that may have been said, or if you are so impacted with this press conference that you feel you want to share it with someone else who will also love to hear what is being shared today. After all of our mothers have spoken, we will have time for questions and answers. Please note that you are invited to put your questions in the questions and answer box below at any time, but again, we will be taking questions at the end. Before I turn it over to Dr. Tamara Alt, the Executive Director of Broken No More, I would like to play a short video. After the video, Dr. Tamara will introduce each mother and lead us through their remarks. Thank you so much for joining us.
Just for 1 minute, pretend like you found out today that your child had a substance problem. What would you do?
My son's name my son is Tyler Cordero.
My cousin Derek overdosed. My cousin Brad, my cousin Curtis, my cousin Danny, they all died as the result of drug use because they could not access resources on their terms.
Michael was dependent on heroin. I made a promise to him that if something were to happen, that I would help people who were like him.
I lost my son to an overdose in 2020, and since then I've been working on different ways to prevent this from happening to other parents.
That's what makes me get up and go to work every day.
I think that stigma that we encounter when we lose children to overdose makes our grieving process harder. It's a primal injustice, and you want to blame somebody. And there is no justice for losing a child. Nothing can ever make that right.
It's not anybody's fault. It wasn't my fault that Michael started using. It wasn't a group of friends he hung around with. It didn't make him a bad person.
There are people that don't speak about their child because they don't get support, and that's wrong. There's many people that I've spoken to who initially blame the dealers for their child's death. But when you're able to grieve authentically and people are validating your grief, you're able to see that it's the system.
I don't know anybody that hasn't been impacted. The drug laws the lack of resources, the incarceration, all of those play an impact on people that live in Black communities. The war on drugs is just the new Jim Crow, and it hasn't stopped anything.
Politically motivated people will prey on grieving families. They're looking to advance their agenda, and they really don't care about our grief. Today, many states are passing legislation with stronger penalties, and it's counterproductive because it's going to end up increasing death.
There are many states, including mine, who are now passing some really cruel drug laws for just simple drug possession, changing small amounts to be felonies.
In some jurisdictions, people are facing murder charges just because they were there when their friend overdosed. People who use drugs are just people. They're not the enemy. They didn't cause this crisis.
People who use drugs look just like you and me. They're just people. Substance use is a health issue. It's not a moral issue.
The very things that could save people are being outlawed. They're trying to defund everything that is related to harm reduction.
There's a better way. There's leaders out there advocating for real solutions.
Overdoses are preventable. We actually know what will prevent them. That's harm reduction.
Harm reduction is just a realistic approach to a situation that we don't have simple answers for. We're just really trying to keep people alive.
Increasing criminalization is just perpetuating this crisis.
Punishment is not the answer.
Putting everybody in jail is not going to make one bit of difference.
This movement towards compassion and proven public health solutions is being led by parents like me. We need to grow this movement. Join us. It's going to take moms and dads.
Families support harm reduction,
not prison.
Say yes to policies that work.
Really quickly, sorry, Tamara, before I hand it over to you, I wanted to confirm, were you all able to hear that audio? Okay, great. Again, as I said, Zoom hiccups still exist. I wanted to make sure everyone heard that audio. Turning it back over to Dr. Tamara. Thank you.
Thank you for joining us today on the eve of Mother's Day. My name is Tamara Alt, and I have spent the last 13 Mother's Days missing a piece of my heart. My 16-year-old son, Joshua, died of a heroin overdose on April 29th, 2012. He used alone, overdosed, aspirated, and died. Life has never been the same and never will be with the emptiness of one of my children not here with me. A light gone too soon from a completely preventable event, overdose. I'm a physician, a grieving mom, and today I'm here also as the executive director of GRASP Broken No More. GRASP stands for Grief Recovery After a Substance Passing, and this organization supports thousands of families grieving the loss of a loved one from substance use with a private Facebook group and over 100 peer-led face-to-face chapters throughout the US, UK, and Canada. Broken No More is the advocacy and education side of our organization. The mission of Broken No More is to support health-based solutions to substance use and advocate for life-saving policies and against harmful laws that will only cause more lives to be lost. We have hundreds of families who join us in supporting this mission. Last year, nearly 90,000 beautiful lives were lost to overdose in the United States. And though these numbers are decreasing, it's still an unacceptable amount of lives gone too soon. We believe that taking a public health approach that seeks to support, not punish, people who use drugs is crucial to ending the overdose crisis. We must expand access to evidence-based strategies that are proven to save lives. This includes medications for opiate use disorder, making them more widely available, increasing harm reduction and addiction services, distributing naloxone, and providing evidence-based drug education for young adults. Harsh drug laws are harmful, costly, and steeped in systemic racism. For decades, criminalization has led to the separation of families and filled our prisons without helping those struggling with substance use. Rather than continuing to criminalize and stigmatize people who use drugs, we must prioritize health-based, life-affirming solutions. Every person deserves access to life-saving care free of judgment. Every mother, every parent deserves to watch their child grow up and thrive. To end this crisis and prevent other families from experiencing the devastating loss of the one they love, we as communities and individuals must meet people who use drugs where they are and offer the utmost compassion, understanding, respect, and love. I can't get my son back, but I can continue to advocate for sane drug policies that will spare other families from the unimaginable pain that my family has endured for the last 13 years. We, as mothers, call for an end to the war on people who use drugs. To my son, Josh, who guides me every day, I miss you, I love you, and I wish you were here fighting by my side, but I will carry on in your memory, and I'll let love show me the way forward. Now I'd like to introduce our next speaker, Kara Wachowski. Kara is from California and lost her 31-year-old son, Eric.
Thank you, Tamara. As Tamara said, I'm in California. I reside in Oakland, California. I'm a business professional, a scientist by training, and now a certified grief educator. I lost my son to a fentanyl overdose just one day before Thanksgiving in 2022. He was 3 weeks shy of turning 32. The tragedy of his death is not just personal loss, it's emblematic of a terrifying truth. Eric was the victim of a system that had failed him repeatedly. It's a system that's built to punish those who are suffering rather than support them. For half of Eric's life, he battled substance use disorder. Like many mothers, I began in denial, searching for someone to blame, his friends, the school, my husband at the time. I used misguided tactics like pressuring, bribing him, pleading with him to just try harder. I even embraced the harsh philosophy of tough love, believing that incarceration might snap him back into reality. He went that route, but even prison proved no deterrent. And when he found himself homeless, my heart shattered again and again, realizing that love alone couldn't fix him. What became painfully clear is that I needed to understand substance use disorder, not just how it affected our family, but how it is a chronic brain disorder. I couldn't stop Eric's drug use, but I could help keep him safe. So we embraced harm reduction. For example, we celebrated when Eric transitioned from injecting fentanyl to smoking fentanyl, and we saw a resulting fewer emergency room visits for skin infections and the like. In 2023, we saw overdose decline in most states. However, this decline didn't reach all populations, particularly among Black men. It's infuriating to think these deaths could have been prevented. And these deaths are still happening while politicians abandon effective strategies for dealing with this crisis, all while still demonstrating a fundamental lack about the disease itself. We're in a stark reality, and the truth is getting lost in all of this hypocrisy. Increased prohibition only leads to more potent substances flooding the streets, putting more lives at risk. Funding cuts have decimated research, education, and supportive services for those battling substance use disorder. People are going to use drugs. That's an undeniable truth. Instead of relying on fear-based tactics and rhetoric, we must prioritize education that empowers individuals and communities. The emphasis on arresting dealers is misguided. The belief that harsher sentences will deter cartels is just naive, and it's dangerous. Proponents of drug-induced homicide laws often weaponize grieving families seeking retribution, only to further stigmatize those with chronic drug use. And this perpetuates the harmful myth that prosecutions will reduce drug sales and use. But there is no data to support such claims. Moreover, we cannot ignore the statistics that once released from prison or jail, individuals are 129% more likely to overdose and die within 2 weeks of release. Prisons operate as profit centers, not treatment centers. And forcing individuals into drug treatment is a waste of precious resources, and it only creates a revolving door back to prison. My son's experience reflects the data. No punishment will deter drug use. My heart really aches as I think of never being able to touch Eric again, or tease him about his hair, or witness him starting a family of his own. But in the midst of this unbearable loss, I ask you for your help. Please start by understanding substance use disorder. It's a complex brain disorder, not a moral failing. Advocate for harm reduction services both locally and nationally. Insist that your tax dollars are directed towards saving lives and prioritize health-based solutions over incarceration. Together, we can create meaningful change. I do this work to honor my son's life and to hopefully save more lives going forward. Thank you.
Tammy, we'd need you to get off mute, please.
Sorry. All right, let's try that again. Our second speaker is Kimberly Douglas, who lost her 17-year-old son, Bryce. She is the founder of Black Moms Against Overdose, a support group for moms who have lost children to overdose, and she is from Maryland.
Thanks, Tamara. I appreciate that. Good afternoon, everybody. Nearly 2 years ago, I lost my 17-year-old son, Bryce Jackson, to fentanyl poisoning. Just 1 month after graduating high school and 5 days before his 18th birthday. Bryce was a loving, smart, funny, and creative young man, one of my 2 heartbeats. Diagnosed with ADHD as a child, Bryce was used to taking medication. During the pandemic, he began self-medicating with over-the-counter drugs and marijuana to help with his, to help manage his mental health. After the pandemic, he returned to school and started spending time with a different crowd, and they began experimenting with pills. I never imagined that would be the beginning of the end. After his death, I searched for other mothers who had lost children to overdose, but in many of those spaces, those other mothers shared my life experience, but didn't look like me or share my values. Having worked for the past 18 years in progressive politics, I have been exposed to harm reduction, but that was never really my main focus until after Bryce passed away. So many of the support groups that I joined after Bryce passed away were supporting drug-induced homicide laws that charged someone with murder if a person that used drugs died. What they often didn't realize is that these laws disproportionately harm Black and Brown communities. They turn tragedy into punishment and do nothing to save lives. I later learned that the person that sold Bryce the fake Percocet was a 15-year-old Black boy, likely a friend of Bryce's. Was I angry? Absolutely. But locking up another child wouldn't bring mine back. Criminalizing people struggling with substance use only fuels our prisons and fuels more overdoses, especially in communities of colors. That's not justice, it's failure. This journey has been incredibly lonely. In the Black community, we're taught to be strong, to survive, but not always to grieve or to talk openly about mental health and substance use. That's why I founded Black Moms Against Overdose, a private Facebook group that offers a safe space for Black mothers like me to share, support, and heal. Our stories matter. Our voices can fight stigma and change lives. Some communities are seeing overdose deaths decline because of harm reduction. Things like naloxone, fentanyl test strips, and medications for addictions are available. But Black and Indigenous communities are being left behind. We face barriers to accessing those life-saving tools. That's why I've been working with Vital Strategies on their You Have the Power to Save Lives campaign to raise awareness and to push for equitable access to naloxone. Meanwhile, the DA and law enforcement are using stories like mine to push for harsher sentences and outdated drug war policies. I refuse to let my son's story be used to justify more incarceration. Bryce will never walk through my front door again. The hole in my heart will never close. But I can fight to make sure that other families don't feel this pain. Together, we can grieve and act into action, break the silence, and save lives. Thanks for the opportunity to speak.
Thank you, Kim. Our next speaker is Sarah Cooper, who lost her 19-year-old son, Maxwell. And Sarah is from Florida.
Hi, thank you, Tamara. So my name is Sarah Cooper. I lost my son, Maxwell, when he just turned 19. It was a week after his 18th birthday. And we had a relatively short period of time of struggling with substance use disorder because of the mortality that's involved with opioids. So Maxwell was a baseball player. He played in the orchestra for his school. He was a Duke tip kid. He was smart, athletic, funny, had a million friends, was the life of the party. But unfortunately, after he got his tonsils taken out, he found the love of opioids when he was sent home with Percocets and Vicodin liquid. And even though we monitored it, he found how it made him feel better. He had anxiety and he was self-medicating, like I think most of these people are. We have to know that there's a comorbidity with what's going on with substance use. There's usually another underlying mental health issue. So Maxwell, sorry, I didn't have anything prepared like everybody else, so I'm kind of off the cuff. We didn't really have much. It was hard to find help for him because he was a minor, right? So there weren't any programs in South Florida that would take him in. A lot of the therapists would only work with 18 years and older. So we found somebody that helps place in the wilderness programs. So that's where Maxwell went, was to a wilderness program. And he spent the good part of a year out in Utah at a wilderness program and a therapeutic boarding school, which is kind of like a sober living facility for children that are not of age. When he came home, he went right back into his same habits and then moved on to heroin. I didn't really know much about harm reduction until after the point of his death. And when Maxwell died, he was at home on house arrest. He was under house arrest for drug-induced homicide because one of his friends that he sold drugs to died of an overdose. And it's kind of, the special prosecution let him go home on that, and also with a Vivitrol injection. But no one ever explained to us anything about harm reduction, medication-assisted treatment. We didn't know anything about any of that. It was get this Vivitrol injection. Well, he overdosed 3 days before he was supposed to go and get his next injection. And I really think that if we had been told about medication-assisted treatment for him, perhaps methadone, buprenorphine, anything that's available, as well as what harm reduction was, we didn't know anything about that. And I found out the hard way. And I think with all of these cuts that are going on, we need to realize that harm reduction can save lives. Penicillin has saved the most lives throughout US history, and that's readily available to anybody that needs it. Whether you have to go and get a prescription, but there's multiple generations of it. It's very inexpensive. Narcan can save somebody's life, but it's being taken off the shelves. It's not being, we're cutting all the funding for that. And that can save lives just like penicillin. I mean, the last 10 years, we've lost 1 million lives to overdose. And we know what the formula is to save these lives. We're losing our future of America. We may have lost beautiful artists, musicians, politicians, business people, entrepreneurs that may have been the next, Thomas Edison, if you may, and they're all gone because we couldn't save their life. And we know what the formula is. The US government started the war on drugs in 1971 under President Nixon. And since then, we've spent $1 trillion on that, with an average of 39 billion being spent every year. I think if we redirected those funds to focusing on mental health, let's get to the root of the problem and saving these people's lives instead of trying to they're not even preventing, it's reactive. We're spending all this money in the wrong way.
Thank you, Sarah. Appreciate your thoughts. Our next speaker is Anita Garrett, an advocate from Milwaukee, Wisconsin, who lost her 31-year-old son, Sammy.
Thank you, Tammy. Hello. Hello, everyone. My name is Anita Garrett. 14 years ago, I lost my son to an overdose. He was addicted to the ecstasy pills. That's the street name. And the pills he took that night was laced with fentanyl. That night changed my life forever. My son was in a house full of people partying, drinking, smoking. And when he began to go into a seizure and overdose, instead of them helping him, they all ran. They ran because they were afraid of going to jail. They didn't call 911. They didn't administer naloxone. They left him there to die because of the fear. People in our community should be supported to save lives and not feel punishment for doing it. We need to raise awareness about naloxone. I'm sorry. Oh, I'm sorry. Okay. I get so emotional every time I tell my story, but I feel that it's important. So I'm going to start off. They left him there to die because of the fear of going to jail. People in our community should be supportive to save lives and not fear punishment for it. We need to raise awareness about naloxone, but also change the laws that now can actually punish someone for saving a life. And that's what haunts me every day, because my son's life was worth saving. If someone had just called for help, if someone had just used naloxone, if the law actually enabled them to use naloxone without the fear, my son might be here. He could have lived. He could have grown. He could have healed. No mother should ever have to feel the pain I carry every day. No family should have to bury a child. Others were too afraid. That's why I'm here today, to speak for my son, to speak for so many others who lost loved ones, and to speak for the lives we can save. That's why You Can Save Life campaign. That's why I joined the campaign. You have the power to save lives. I want to share you a little story about myself. I am a recovering addict myself. I've been clean for 14 years. Part of this, I believe that my son endured seeing me doing drugs. And that's how he got into the street life of being with other people. But I don't blame myself. I blame the system, because when I used drugs, I didn't have the resources. But now we have resources. And thanks to the campaign, we have the power to save life. They have access to naloxone. They can use it without fearing of going to jail. And that's a big part of what's going on in Milwaukee. Also, there is a law about the Good Samaritan. We don't have it here in the state of Wisconsin, but there is a law. that prevents people from, people are afraid. If they save a life and the police come, they on the they fear that they're going to go to jail. They feel it's most people that's on probation and parole here in the state of Wisconsin, and they are. Most Black people's really, I'm not being prejudiced enough, but we do have criminal backgrounds. So when you're in a household and you're doing drugs and something goes wrong, that's your first thought, is to run. And it shouldn't be that way. It should be a way that a life is worth saving. We shouldn't have it. We just need the lawmakers to change the law and quit being so hard on people that use drugs. Because instead of using programs, instead of locking them up, put them in a program where they could seek help. Keep hope alive. Again, that's why I joined the campaign of We Have the Power to Save Lives. Thank you.
Thank you, Anita. And I want to acknowledge and say thank you to our brave speakers. I've been speaking about my son for the past 13 years, and it's still hard every time. It brings up emotions. We're speaking about our dead children. So not everybody is able to do this. And I want to say thank you to everyone who spoke today for telling their story and to stand up and in the name of our children and advocate for change. So thank you. So the speakers have finished. So Gloria, we can now open up the meeting to questions.
Thank you, Dr. Tamra. Thank you, Kara, Kimberly, Sarah, and Anita. I really appreciate you all being here with us today and sharing part of your experiences with everyone here who's on the call. Mike, if you could please type your question in the chat, that would be the easiest way to make sure all of our questions are in queue and getting responses. I wanted to take a moment to, again, point out the layers of what that had been touched on in this short call here, right? Drug use, overdose prevention is a complex issue that takes a very human approach to address in a number of different ways. And from hearing from all of you all, I hear the love, I've heard the different options you explored. And the theme that I also hear is, unfortunately, a lot of us don't get information about services, health, public health and health-backed services that can help save lives, right? And we don't want parents to continue to learn after a loved one, their child, has passed from an overdose. And this is why we're here today, and this is why we do the work that we each do together and collectively. And one of the questions, this question is for anyone, just came through in our Q&A, is first, this question is from Mike, apologies. His first question is, there has been a dramatic decrease in overdose deaths, particularly in the last year. What do you all attribute to this decline to?
I think it's awareness. I think it's the resources. Instead of utilizing the community, faith-based leaders and communities and keeping hope alive and the locks on. Having access to that has changed and it's showing a very good impact in the state of Wisconsin because they're using it.
Yes, I agree with what Anita said. Also, the testing strips. So people are being smart before using. But I also want to highlight what Kimberly shared, is that overdose deaths have not declined in the Black and Indigenous communities. So perhaps you want to say more about that, Kimberly?
Sure. So, I actually attribute the decline of deaths to, to mothers like us, like Dr. Tamara, I'm sorry, just said earlier, her son has been gone for 13 years. So mothers have been doing this for over a decade, right? And so eventually people are going to start listening. Unfortunately, it's taken 10 plus years for people to start listening. After, Bryce passed away in 2023, and I live in Prince George's County, Maryland, right outside of DC, and it's we're in a bubble of, a mixture of all cultures. It's a huge African American Black community here. And Bryce passed away, and I have yet to meet another mother in my area that has a child who has passed away from fentanyl from fentanyl poisoning or overdose death. And so that's unfortunate. After Bryce passed, I had a mother reach out to me who had lost her son to a gun violence, and another mother who had lost her daughter to a car accident. But yet, I have yet to hear, no one has reached out to me. I have yet to find another mother in this area who has lost a child who was willing to speak up because of the stigma and because of, it's a very isolating loss. And so, in Prince George's County, just over the last year, I've started to see commercials about naloxone and being aware of opioids and overdose death. But, it's just now starting to show up in the African American community, which is completely unfortunate, which is, why both Anita and I have been really dedicated to working with the You Have the Power to Save Lives campaign through Vital Strategies. They've identified 7 cities around the country that have a high population of African Americans that don't talk about this at all. So I think, it's very important that, the Black moms against overdose. I know there's another group that just came out, Black Families Against Fentanyl, that's on Facebook. I don't know, I don't know if they're drug-induced homicide-led or harm reduction, but we need to talk about it. Black people need to talk about it. People of color need to talk about it. And I think it's a cultural issue. After Bryce passed, my family is from the South. They're from North Carolina. And, I had family members telling me, you don't need to tell everybody how Bryce passed away. Why not? If I don't share his story, people don't know. It just further stigmatizes the issue. I had a cousin who passed away in 2022 in December. His immediate siblings, were scared to death to have an autopsy because he was an avid substance use, he was an avid user. So, I would bet my life that he died from fentanyl. So, we just need to start talking about it. And I hope that answered your question.
Thank you all for those responses. I really appreciate it. We have another question that just came in. I believe, Kimberly, you touched on it a little bit in your last remarks, but this question is for everyone. What do you guys feel is the most important priority to fight for in this moment?
I think we have to continue funding harm reduction and syringe access programs and naloxone. I mean, nothing has been passed at this point, but there's suggestions in the budget of cutting naloxone funding, which is critical. I mean, right now it's everywhere. It's easy to get in most communities, not all, of course, and Medicaid paying for medications for opiate use disorder because it decreases mortality by 50 to 75%. So if we see people not able to afford these medications, if they're not able to get clean syringes and access to all the things that harm reduction does, including treatment on demand, our numbers are going to reverse. We can't let any of that slide. All 3 are super, super important.
Sarah, were you also going to add something?
Nope. I agree with everything.
We all agree.
Yes, Tamara covered it perfectly.
Thank you. Another question that we have in the question and answer is, what advice do you have for families who have lost a loved one struggling with drugs?
I would jump in. I think it's been completely healing for me to be around other families who have lost loved ones to overdose. I find like I mentioned, I find myself in rooms with people who don't look like me. And that's okay because I get the support that I need, right? But it's very isolating. And so I just would urge any family who has lost a loved one, through an overdose to seek out organizations who are doing good work on the ground, who are offering support services to grieving families. I mean, you know, it's ironic. Before Bryce passed, I had a very hard time finding help, support, even through NAMI. Like it was just so overwhelming. And then after he passed away, it was like out of the woodworks. I had all kinds of, grief specialists reaching out to me. So it's, it was very hard to find help prior to his death. And then after he passed, it's like everybody is reaching out to you. And I don't, it should be the reverse, right? When you're dealing with someone who is dealing with mental health and substance use issues, there should be people out there to help support you, but it's been very difficult to find that.
Yeah.
And go to grasphelp.org, please, for GRASP. That will give you access to all of our face-to-face chapters and guide you to our Facebook page. We are the largest organization in the United States helping people who've lost someone to substance use. So please reach out to us. We're here for you 24/7. Sorry, Kara, go ahead.
That's okay. I definitely believe that healing occurs in community, and we are already isolated by the life we've been living, and then the world wants to diminish our grief. They don't want to get close to it, and that's not right. So I think that you will find comfort in places where other moms or people understand this type of loss. I also wanted to say that, sharing your story when you're ready, and choosing the people you want to share to. You don't have to do it in a big public platform, but our stories have so much power, and that is what's going to change minds. So I would encourage you to give yourself grace. This is such a difficult place to be, but share your story if you're able to.
I would piggyback on that, when it comes to, like I said, I am a recovering addict myself. So what I do to keep my son's memory alive, I tell my story. I tell the truth, the whole truth about drug addiction and how my son died and what happened to him, hoping that other families in my same situation that I am hear that story and let them know they're not alone, that there's help. Not only that, a lot of people are in denial, thinking that it can't happen to them. It can happen to you. So I'm letting them know to get naloxone, get the resources that you need. At the end of the day, this is about saving a life. Like I said, when my first statement, I got a little choked up. I'm still hurting. 14 years later, I'm still hurting, but that's not going to stop me from getting out there trying to help save another parent from going through what I went through. Get naloxone, put it in the car, put it in your home. You don't know what your kids are doing. I didn't know my son was on ecstasy pills out there. I didn't know it. So I just want to educate the community and let them know, use the resources, carry naloxone. All lives matter. Don't wait until it happened and then try to learn how to use naloxone. Educate yourself now.
You know what, Anita, that's a great point. I just want to share that my son, he wasn't in active addiction for very long. He had just started before he passed.
Yes.
And my son had, he carried naloxone on him. And, his friends knew that. And so when I unfortunately found Bryce at home in bed. And I had actually told him to go take a nap prior to his death, and walked him to his room and laid him down and told him I loved him and I'd wake him up in a little bit for us to spend the rest of the afternoon on a Friday together. And when I went to go wake him up an hour later, he wouldn't wake up. So I ran to go find the naloxone, and I couldn't find it. And we realized after the ambulance had gotten here and they worked on him that he had naloxone in his pocket. But what haunts me to this day is that even if I found the naloxone to save him, I know now how to use it. But at the time, I don't know that I would have known what to do with it, except maybe just stick it up his nose and pray that it worked, right? So like getting training, offering training centers on how to use these life-saving devices would be another thing that I would urge, like our counties, our local counties to focus on, our states to focus on, and these support groups as well.
And if you know someone in active addiction, encouraging them not to use alone. There's an organization, Never Use Alone, where someone with lived experience will be on the phone with you and call for help should you not be responsive. So that's another option people can use.
Thank you.
Thank you, Kara, Kimberly, and Anita. Thank you all. We're gonna start to wind down, but I did want to ask the question, if there are any elected officials, Congress members that are sympathetic to you all's cause, to our cause, that we should contact. So people are in the chat asking, how can we amplify you all's voices? And if there is any elected officials you all know about that they should reach out to and help amplify your voices through.
I'm working on a more local level, so I don't have a good answer for that question.
I don't either, but I think that as long as we all continue voicing and speaking about what's happened to our children, that we can reach people. You know, you can break the stigma, break the judgment with continuing on the stories, because it is an isolating disease, if you may. You know, it's not something that you go and you discuss that your child has a substance use disorder, is you know, shooting heroin, that has such a stigma attached to that. And then with the death, I know that my in-laws are Cuban Americans. So when my son passed, my mother-in-law said, "What are you going to say about Maxwell, how he died?" And I said, "I'm going to tell the truth. He died of a drug overdose." And she said, "Well, I'm going to tell my friends that he had a heart attack." You know, and once again, that's isolating.
I agree. I was told the same thing about my son, and I refused to lie because I was trying to bring awareness. This generation now are using all of these different methods of ecstasy pills, gummies, and all of that. And they need to be awareness. They need to be cautious. They need to know it can happen to them. But educate yourself. Get the resources. Get naloxone. Carry it with you. And don't think that it can't happen to you.
Right. I'm so grateful. The last year of my son's life, we were practicing harm reduction, and it gave him dignity. And he was much more honest in our communication. Sometimes I didn't want to hear what he had to say, but I'm really, really grateful that we were in a good place when I lost him. And that's all due to harm reduction.
Again, thank you all so much for being here. Thank you for your questions. Thank you for your remarks. I want to turn it over to Dr. Tamra in case you have anything else you'd like to share, or if any of the mothers have anything else they'd like to share before we close out. If you are part of our audience here today and you have any questions, please feel free to quickly get those into the question and answer chat. But Tamra, I'm turning it over back to you.
I just wanted to say thank you all for joining us today. And thank you to the brave moms who told their stories. If we as a society can see the world through the eyes of a mother with love and compassion, I believe the way forward is clear. We have to end our carceral mindset and treat people who use drugs with the respect and dignity that every human deserves. Overdose is preventable. We know what works, but we have to stand with courage together, and we have to demand that life-saving solutions are implemented. And we also have to demand an end to stigma and criminalization. So to sum it all up, I believe love is the clear path. If we can all just stop stigmatizing and hating and wanting revenge and punishment, we know what to do. So let's all stand together and with organizations that are all of like mindset, because it's going to take a lot of us to resist some of the change that's trying to happen. But we can do this. We just have to stay strong and stay the course. Thank you.
With that, I will thank you all for joining us today. Links have been dropped in the chat to references that have been made during this press conference. We have You Have the Power to Save Lives campaign, which you will be able to access naloxone across 7 states. And if your state or city is not listed, you're able to get naloxone mailed to you free of charge to your home in discreet packaging so that you have it on hand. We have shared the link to Kimberly Douglas's Facebook group for Black mothers who are grieving from losing children to a preventable fatal overdose. Dr. Tamara Halt has shared the grasphelp.org URL, which you can connect folks who you know are grieving the life of a loved one lost to an overdose so that they feel less isolated and less stigmatized in their grief. And we thank you again. And as we think about, again, Mother's Day this month and this weekend, please remember that we have power to change the ways in which our society, person to person and systemically, looks at people who use drugs and how we react to people who use drugs. And, as said over and over again, this is about saving lives and making sure that our loved ones can stay with us as long as possible. Thank you for your time. I hope you have a wonderful afternoon, and I look forward to hearing any correspondence from any of you all. Thank you.
Thank you.
Thank you.